Dr. Marty Becker, welcome to Australia again.
Thank you, my friend.
You're on a mission.
I'm like the dyslexic blues brother. I'm on a mission from dog. I'm working to create fear-free veterinary visits, which is something I've, previous speaker today was talking about having passion for what you do and loving what you do. And somebody was talking about they maybe lost a passion for animals. Well, I never really lost a passion for animals or people, but this is the single most important thing I've ever done in 35 years of being a practicing veterinarian.
You were telling the seminar attendees they're doing it wrong. You were doing it wrong, being a vet?
Well, it's hard. It was one thing hearing that I'm petting animals wrong and giving treats wrong, but I was literally, it was like you could see it, but it was like background noise. It was like when I used to be a kid and we had 8-track tape, I could still hear the music, but there's background noise that you just learn to tolerate. And it's kind of like that way with practicing veterinary medicine. We've been focused so much on physical well-being. The pet is sick, we need to get it well. The pet is injured, we need to fix it up. We need to do these preventive healthcare programs. But it was all about getting the appointment booked, getting them in the practice, performing the procedures, sending them back home, giving accurate estimates or quotes and friendly customer service. Meanwhile, we ignored the emotional well-being of the pet. So even though we might notice, the pet is scared enough to try to bite us, or the cat is, the type that's gonna, bite or scratch her claws. We always just thought those were the bad actors. Those are the ones that are deemed the pets that we don't want to see, like, oh God, not this pet. When in fact, those are the ones we should give extra TLC for. So it's as simple as looking at physical well-being and emotional well-being. It's done with pediatric dentistry, it's done in pediatric medicine. And once you know the signs of emotional distress, of fear, anxiety, then you just have to know the ways to remove or reduce those anxiety triggers, or if anxiety does flare up, you have tools to mitigate it.
Well, we know for a fact from the statistics that people really don't like going to the vet with their pet. You've got an answer for that and how you can get around it.
Well, it's funny when you actually ask veterinarians or veterinary nurses, they don't even want to take their own pets to the vet. So it's not some, obtuse, random, like, I think I've seen it before. We don't even want to take our own pets to the veterinarian. So really what we do is it's using a variety of techniques. It's really driven by a dream team. There's 120 people on a fear-free advisory panel that are looking at ways to get dogs to actually want to come to the vet. And when their dogs want to come to the vet, pet owners want to come to the vet. I'm not going to say cats want to come to the vet, but they're neutral. And as long as they're neutral and and some of them do want to come, but we're not going to have people driving by with a cat riding in the car, clawing at the window to get into the clinic like we do hear these stories with dogs. But once you look at physical well-being and emotional well-being, people had stopped using veterinary medicine at all, that were relying on Dr. Google and going to the local grocery store for their parasite control. They start coming back, and people that had stopped coming in as less often now start coming back in more often. And even pets that they had at home that thought, there's no way I'm going to take this cat in. There's no way I'm going to take it in. All of a sudden realize, they have a way for us to actually bring this pet in now for examination and preventive care.
Now, I know that you talk for hours about this topic, but in a nutshell, what are the key elements in making the change for veterinarians who might be watching this and for pet owners who are wanting to see the change?
Well, there is two pieces to this. Let's talk about the pet owner first, because you may go to a veterinarian that is just getting started with fear-free. Perhaps they're not even really a big believer in it, but I will tell you, once you know the signs of fear and anxiety, if you're pet, there are going to be veterinarians out there that can cradle that in their hands. So it may even be involved with changing veterinarians. But what you want to do as a pet owner is you want to take your pet into the veterinarian hungry so it responds better to food rewards. You want to make sure when you put the carrier in the car, if it's a cat or a small dog, that the carrier is flat, that it is facing forward, so it's going to be facing the back of the passenger side seat, for example. You want to have it covered, so a light sheet, your coat in an emergency or whatever you want to cover it with, because you want to reduce visual stimuli. When you get to the practice, if they're able to, ask them if you can go straight into an exam room to be checked in. And so if they have the room and the technology, if they don't, park outside, go in and check in, and go back out and wait in your vehicle until it's your turn to be seen. Don't go the same way of putting a leash on your dog, getting the carrier out for the cat or the small dog, swinging it by your side as you go in the door, checking in, then waiting in this stew pot of adrenaline, of stress, which is that waiting area. And then if you're a veterinarian, we're used to finding symptoms. That's what we do. We're looking at symptoms, and based on the symptoms, that's what I think is wrong. So now it's looking at emotional symptoms. And now that I know this, how can I remove these next time? How can I, change this right now? And it may be as simple as using really delectable food rewards, not something that's easy to reject, but a high currency food reward like a piece of a turkey hot dog or something, or spray cheese. It's lowering your voice, using distraction techniques. So having a nurse give them some kind of treat on the end of a tongue depressor while you're doing something that, rather than just coming at them with the needle, they don't even see the needle.
Part of the talk that you gave, I noticed a lot of ideas that I know from being a dog trainer and being trained to be a trainer. Did you pick up some of these ideas from your daughter?
Yes, and it's really neat. There's a bunch of people that, Victoria Stillwell, for example, is on the Fear Free Advisory Panel. Some people know her from It's Me or the Dog. There's some, 34 boarded behaviorists, but my daughter has been really involved with this for the last 6 years, so she taught me, and others taught her. We're all kind of walking across bridges that have been built, but there's actually a right way and a wrong way to pet a dog. There's a right way and a wrong way to pet a cat. There's a right way and a wrong way to give treats. And just working with her, seeing a dog that was really nervous and wasn't settling in and wasn't calming down, and just watching her, throwing a little piece of deli turkey down on the floor, the dog picks it up, the dog comes over, she tells it to sit, it sits, and I see its tail just sweeping across the floor. And so instead of having those terror eyes, those hardened eyes where you see the sclera and they're just staring ahead, now it's real happy because it knows, what, they're asking me to do things, I know what to do, and I know exactly the reward on the other side of doing that task.
I think you're doing a great job. I've been following you, stalking you on Facebook, and I think people will be able to find you there as well, and look up your website, Fear Free, what is it?
Well, there's two places I go. You can go to drmartybecker.com. My other online home is vetstreet.com. It's vetstreet.com. That's where my daughter Mikkel Becker's at as well. And then dvm360.com/fearfree. You'll be able to find the very latest on what we're doing to take the pet out of petrified.
Wonderful. Thank you so very much.
Thank you, my friend.